So, ladies and gentlemen, actually, let's take a look at the cars here. Just show the cars. I'm at the Aston Martin dealership in what city?
Rancho Mirage.
Rancho Mirage, California. And what's your name?
Bree.
Bree has a question for me.
So, how do you differ flu symptoms from this coronavirus symptoms?
Oh, you mean
Now,
like how do you tell which is which?
How do you tell which is which, and when you should take the procedures to go get tested?
That's a very good question. So let me just say the question again. Bree's asking, how can you tell whether you have the coronavirus versus the regular influenza virus? Is that right?
Correct, yes.
Okay, this is a tricky question because for most people, if you have a mild version of this year's coronavirus, your symptoms are going to be exactly the same. You're going to have a runny nose, little stuffy nose, little achy sensation. You might feel a little bit of a cough, mostly a dry cough, stuff like that. But we do have a little bit of information that's coming out right now from people who've actually had the infection. And what people are saying who actually had this year's COVID-19 infection is that it started off like a really mild cold, like a really just barely any cold symptoms for like 3 or 4 days or so. And then all of a sudden, they were hit with like a really high fever and a cough. And the people that ended up going to the ICU are the people who had fever, cough, and shortness of breath. So those are the 3 things. If you have a high fever, if you have a severe cough, and you feel, shortness of breath means you feel that you can't breathe, like you can't get enough air. So that's why people say, I feel short of breath. But what in doctor speak, we call it shortness of breath, but in people speak, it's, I feel like I can't breathe, okay? So if you have those 3 things, you need to come see me in the hospital, plain and simple. Yeah, fever, cough, shortness of breath. Okay, so with regards to shortness of breath, when you tell me that you're short of breath, I always respect it, but there's something that I do to help me know that you're really short of breath. And so the question is, what do I do that helps me know that you're short of breath? I will check your oxygen saturation. Okay? A normal oxygen saturation is about, for a normal person, is maybe 95 or 96 to 100% is a normal oxygen saturation. So when you come into the ER, because you told me that when you were sick, you felt short of breath, right? I'm going to check your O2 sat. And if your O2 sat is 99%, I'm going to kind of think, Bree's probably telling me she's short of breath, but she's in stable condition.
Perfect.
So I'm not going to worry so much about you. But if you come into the ER and you tell me you're short of breath, and your O2 sat is like 86%, then I'm freaking out. Then I'm like, guys, you better call the ICU because we might need a bed. Her oxygen is really low. And so that's what a doctor will do to try to figure out the difference. Because you're absolutely right. A lot of people say, I feel short of breath, I got a fever, and that's legit. But when I check your O2 sat, that's how I know.
That's how you're able to
So
tell.
there you go.
Perfect.
There you go. Yeah.
Thank you.